All right, guys, my name is Gabriel. I'm going to be your instructor for today. All right, and today we're going to be showing you how to do a height and weight. Now, height and weight is one of those skills where you have to be very, very careful. There are lots of people that have a lot of sensitivities, and it's our responsibility as the healthcare provider to make sure that our patient is comfortable, right? We're trying to build that level of trust. So make sure you talk to your patients, because even though we have to do this skill, we can always have our patients not look at it. We cannot tell our patients, and we can leave that for our patients and their healthcare provider. Now, when it comes to doing a height and weight, there's a couple of things that we need to know about our standing scale, right? One, we have what we call the gross weight. That's down at the bottom. Our gross weight goes in increments of 50. We're going to move that gross weight first to figure out about where our patient's weight is. And then once we know that, we use this fine-tuning weight up here at the top to get a much more precise measurement, all right? Now, when we're doing this skill, just like other vital signs skills, we do not need to wear gloves. This is a non-glove skill. All right, now with me I have Miss Ashley. She's going to be working as my patient today. All right, so what we're going to do is we're going to show you how to do that skill. All right, so hi Miss Ashley, my name is Gabriel. I'm going to be your CNA today. Just coming to get your height and weight. Is that okay?
Yep.
Fantastic. I'm going to make sure I wash my hands before I do anything with you. All right, now first thing I'm going to have you do, I'm going to have you step up on this scale. Please be careful. I don't want you to fall. Perfect. Now that my patient has stepped up on the scale, I start moving that gross weight down at the bottom. What I'm looking for is for that weight to drop to the bottom. When it drops to the bottom, that lets me know that the weight that I have here is heavier than my patient. So I'm going to go back one, go back to the 100, and then we start moving that fine tune. Now what I want, just like that, is I want for this little arrow, I'm not sure if you can see it, but I'll show it to you just in case you can't, to be floating in the middle, not touching the top or the bottom of this little square, okay? That lets me know that that lets me know that I'm exactly even with my patient's weight.
Okay.
All right, so now what I want is I want to make sure that this arrow is floating in the middle. That lets me know that I'm exactly even with the weight of my patient and the weight on the scale, right? Now, in order for me to calculate that, I want to look at that bottom number. There's that 100 pounds. Then I add it to my top number, 46. That puts Ms. Ashley at 146 pounds, all right? Now, when it comes to taking a height, what I'm going to do is I'm going to have Ms. Ashley turn around on the scale very carefully. Ms. Ashley, if you turn around. Take like a half step back. I want you to all the way on the scale. Perfect. All right. I'm going to go ahead and zero that scale so it's not bouncing around on us. All right. Now, I pull this out and I bring this down until it's just touching my patient's head. Boop. All right. I'm going to have Miss Ashley step off that scale for me. Now, when it comes to doing the calculations for it, what I want to do is I want to find the bottom part or the middle of the scale, and I read this from the middle. Now, if you're looking at our scale here, we have our inches, our feet in inches, and our centimeters, right? So Miss Ashley looks like she is 5'1.5", almost 5'1", or if we want to be more accurate, 153 centimeters. We could also say she was 60 inches. All right. All right, after you've done all of that, you want to thank your patient. Thank you so much, Miss Ashley. You make sure you wash your hands and then go record and report.